Yeah, trastuzumab deruxtecan is a novel antibody drug conjugate, and we're all really excited right now about antibody drug conjugates as a way to deliver toxins directly to the cancer cell and potentially improve efficacy. And in fact, we've seen now improved efficacy with the antibody drug conjugate sacituzumab govitecan in metastatic triple negative breast cancer, not just PFS, but also overall survival. And then trastuzumab deruxtecan has shown us really remarkable data in heavily pretreated HER2-positive breast cancer, as well as a hint of early efficacy in what's now been defined as HER2-low disease. So HER2 not amplified by FISH, but 1+ or 2+ by IHC. So at San Antonio this year, the group presented an update with longer follow-up of the patients who were on DESTINY-Breast01. This was an expansion study, right? So nobody was randomized, and the final dose that was felt to be safest was 5.4 milligrams per kilogram given every 3 weeks. What they showed was a really striking and remarkable progression-free survival now of 19 months, really pretty amazing, and a very impressive overall survival as well in these patients. Again, not randomized, but heavily pretreated with HER2-positive breast cancer. There has been, this is an IV drug that's given every 3 weeks. You can lose your hair, but hair loss is not very common, and it causes some nausea and count suppression, but overall, we've been able to control that symptom pretty well, even in these heavily pretreated patients. But the main concern with trastuzumab deruxtecan has been interstitial lung disease, and if there hadn't been for that, everybody would just get that drug first, But it's of course being studied now in earlier line setting compared to T-DM1, and both in metastatic disease and in the post-neoadjuvant setting. ILD is a funny thing, it's hard to diagnose very, very early. And what they showed at this update at San Antonio was that there were 3 more cases compared to when it was presented and published in December of 2019 at the last San Antonio. And one of the cases was grade 5. The patient died of ILD. And they showed a nice curve showing that basically most of the ILD events occur in the first year, but they have seen some events occurring at, around 18 months. So this appears to be related to the toxin attached to the antibody. The antibody is trastuzumab biosimilar, so it's not causing this. But trastuzumab deruxtecan must be, and in the new antibody that was also presented at ASCO by Ian Kropp that targets HER3, they have a different antibody, but they use the same linker and the same toxin, trastuzumab, this derivative of deruxtecan. In that, they also saw 1 grade 5 ILD and some earlier grades of ILD. So I do think it's probably toxin dependent, and hopefully we'll be able to figure out earlier identification and management of this problem, which I think is important as we move this earlier in the lines of therapy.